ladies and gentlemen. This is Dr. Mintz. This is a very interesting case. This is a patient that has chest pain and abdominal pain. I'll give you a chance to kind of peruse these images. Okay, and I will bring your attention now to the vascular structures. Think vascular. Anything seem odd in the vascular department here? Okay, well, let's take a look now. You know that the aorta and other vessels often have calcifications. Right here you can see calcifications in the iliac arteries, for example. The left is very tortuous. Follow that up here a little bit. Let's go up and see how things look. Well, something's awry there. Something is awry. Let's see if this zooms in a little bit. What do we see? We see that right here, the calcifications don't look like they're in the wall. What does that suggest? Can you come to a diagnosis? Do you know what this might be? Let's look up a little bit higher. Is that the case up higher? Well, it looks like yes, that's displaced from the wall. And even here, look, that's displaced from the wall. And what are these two little flecks right there? They're tiny, but that also is suspicious. And look at this little calcification there. This is, let's see, that's the celiac artery there, so that's the superior mesenteric artery. That little calcification there is pretty subtle, but seeing the other ones, I feel like that's probably real. So they all suggest that the calcifications of the arteries, some of them are displaced. Where are the calcifications located? They are intimal calcifications in the intima, the innermost lining of the arteries. Look at this one here. This is the most provocative image to me. Those little tiny calcifications right there. This is the aorta. Here's the diaphragm, so you're right at about the level of the aortic hiatus. Those little calcifications are intimal calcifications. You don't get calcifications in the middle of the aortic lumen. So what would cause the intima to be displaced from the aorta wall, the aortic wall? A dissection. This is, by definition, an aortic dissection. Life-threatening condition that often requires emergency surgery. So that's what we're diagnosing here. How do I know for sure? Well, I know for sure anyway, but if one had any doubt at all, you can look at this enhanced study, and sure enough, there it is. So this is a very nice graphic depiction of how the intima is displaced from the wall, and how looking and seeing just the displaced intimal calcifications can tell you that you have an aortic dissection. So this is where we were looking in the lower thoracic aorta, and then at the level of the aortic hiatus, you see the dissection, the intima displaced. So this looks like it's the true lumen and that's the false lumen at this point, but I'll have to go up a little higher, see if that's true. Yeah, that looks like that's all true lumen. So this is true lumen here, and then you have a little re-entry of flow into the false lumen there. And we saw something right at the SMA origin, and sure enough, let's see, there's SMA there. And here's celiac artery, and you can see the celiac artery is involved too. So this is an aortic dissection, interestingly revealed on the unenhanced images by virtue of the displaced intimal calcifications. here shown very nicely in the coronal plane.